here. That indicates to me that up until pregnancy, they're not going to grow significantly.
Okay. You brought another picture here. This is another surgery that you will perform. This is a what, liposuction?
This is liposuction of a tummy. So this is a teenager who brought in baby pictures of herself when she was 18 months old with skinny little arms and legs and a big tummy, and everybody thought how cute she was. And as you can see from her hips, I mean, she's not overweight, but she has that pooch and it doesn't go away and it hangs out of her clothes, and she's miserable every day when she gets dressed. So she had a liposuction, which is an ambulatory procedure, meaning outpatient, and this is her result, and she feels completely different.
Just a lipo, not a tummy tuck.
This is not a tummy tuck. I would not do a tummy tuck in a child or a young woman who had not had children yet.
Okay. Do we have time to go ahead and jump into the phone lines? Teresa from San Francisco, good morning. Do you have a question for Dr. Lee? You're on the air. Teresa, we had you. Okay. We'll get back to Teresa. Are there some particular issues that teens have about plastic surgery that they come to you with? Like, what are the big questions that they have? Will it hurt?
Well, yeah, teens actually are relatively realistic about their questions. So they ask, as do adults, is this going to hurt? How long can I expect to be in pain? Is it going to look good? Am I going to die under anesthesia? So they really are they're pretty thoughtful by the time they get to us, and in a lot of cases they've had to pull their parents along and kind of get their parents interested in and supportive of the idea in order to get them in.
All right, we need to take a quick break. For more information about Dr. Lee, you can call her at 510-704-2170 or check her out on the web at artfulsurgery.com. When we come back, we'll try to we'll get in a couple more phone calls if we can, and then wrap up our chat about teen plastic surgery. Welcome back to Body Beautiful. We still have time for some phone calls about teen plastic surgery. Here's the phone number, 800-440-4884. The number for the doctor's office will be up during and at the end of the segment, so be ready to jot that down. And our caveat, you certainly want a second opinion. Let's jump into the phone lines. Amber from San Francisco, do you have a quick question for the doctor?
Oh, yes, hi. Well, I was wondering, I had a baby about a year ago, and I was thinking about getting a tummy tuck, and I wanted to know, will I have to get my belly button reconstructed as well?
Okay. It depends on how big the tummy tuck is. With a full tummy tuck, we do leave the belly button dimple where it is, but the skin that the belly button's coming out through will move down, and we make a new opening for the belly button. So the belly button basically stays in the same place on your abdominal wall, but the skin moves.
Thanks, Amber. I've learned something new. I didn't know it was called a belly button dimple. Okay, we're back to teen plastic surgery again. I need to wrestle this one. Yeah. But is it like getting braces for crooked teeth? I mean,
well, braces for crooked teeth is certainly something that we've accepted in this society, and clearly good dentition is part of being healthy, and there are functional issues. So it's important to recognize that surgery is a little more risky than having braces done. But in a case like breast reduction, where women or girls are already having back pain related to the size of their breasts, it's a functional problem too. It's not just psychological.
Okay, and again, it's a cultural thing too, because we were laughing about in LA, a graduation present
is breast high school augmentation,
which is
kind of an anathema to those of us outside of LA. But that happens. There are high schools too where between 10th and 11th grade everybody gets rhinoplasty.
All right, and very briefly, what would you recommend for parents of a teen who is asking them
Don't be afraid to talk about it, and don't be afraid to go to the pediatrician and ask for a recommendation to talk to a plastic surgeon. There's never anything to be lost by getting information.
Okay, and it also opens the doors for communication between parent and child about what may be really troubling this child.
Exactly. So don't be afraid, just ask questions. Information's always good.
Okay, well, this is valuable information. It's certainly a fascinating topic, and for people who want to know more, are there websites that you would recommend?
Well, certainly I have information on my website, which is artfulsurgery.com, but there's realself.com, which is a very powerful, informative website. There's the American Society of Plastic Surgery, and there's the American Society of Aesthetic Plastic Surgery that provides a lot of information.
Okay, and we also want to add here that certainly whenever you're considering a plastic surgeon, you've got to make sure that they are board certified,
preferably for breast by the American Board of Plastic Surgery.
Okay. Thank you very much, Dr. Lee. Unfortunately, we're out of time. For more information about the doctor, you can call our office at 510-704-2170 or check her out on the web at artfulsurgery.com. Thanks so much for joining us, everybody. Have a great day. Thanks, Doctor.
Thank you.
For more information about our show, go to cron4.com and click Body Beautiful. Once there, you can see videos of past shows and get contact information for the doctors we featured, as well as listings for future shows.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.